Hi there, welcome to the Red Chair series. This is a groundbreaking initiative that has been brought to you by the American Heart Association Philadelphia and proudly sponsored by Mainline Health. The goal of this series is to really dive into women's heart health, and we truly have an expert here, Dr. Danielle Spragan. She is a cardiovascular surgeon, a leading surgeon here at Mainline Health. Welcome. It's great to have you here.
Thank you so much for having me. I appreciate it.
So can we start by talking about coronary artery disease?
Sure.
And the differences between men and women, because we really want to have that comprehensive understanding when it comes to women's heart health.
Sure, absolutely. So when people think of a heart attack, typically they think of someone having pain on the left side of their chest, and that is the case for men and women. However, often women have different symptoms. So they may have a stomach ache, they may feel nausea, they may feel sweaty, they may feel short of breath, but it's actually your heart. So it's very important for not only women, but for physicians and other healthcare providers to be aware of the differences.
Is it something where we just kind of have to go with our gut if it seems like maybe this stomach ache might not be a stomach ache?
Absolutely. So we know our bodies, we know our own self. So trust your gut. If it's not right, if you have the symptoms and they keep coming back, if it's severe, unrelenting, and pain you've never had, you should just go to the emergency room. You don't want to mess around and waste time.
And you mentioned knowing your family's history.
Yeah.
Why should we?
If you're fortunate enough to know your family history, it gives us a clue as to what might be going on with you. So for example, if you know your dad or your mom had a heart attack in their early 50s and you're 50 and all of a sudden you're having this pain, that's very important. So if you have a strong family history of coronary disease and you're having some symptoms you think might be related, just ask to get an EKG. So an EKG is something where we can look at the electrical activity of the heart. That's a first step. Otherwise, you can go to your primary care doctor, and we have new technologies that allow us to kind of look at your coronary. So you can ask for a coronary CT scan. So these are some of the things you can advocate for yourself.
So when it comes to clinical trials, the inclusion of women is sometimes low.
Right.
Why can that be an issue, and kind of what happens when we don't see women participating in these clinical trials?
What we see currently is mostly men are enrolled in these trials. So a rate of about 15% of women will be enrolled in these trials. We don't know if the pathology is the same in women and men. We assume that everything's the same, but that may not be the case. So if you don't have women in the trials, you can't analyze the data and we can't get further information. So I think what we need to do, and what we're starting to do as a community, is to have trials specifically for women. So where only women are involved, so we can look at all the differences.
What is that outcome? So if I'm considering like being in a trial, one, I'm helping other people, whether it's other women or other women of color in my case, but then what does that data do for a healthcare provider like you?
So when we do clinical trials, these aren't things that are coming out of nowhere. They come from other data that we know is safe. We just don't know if it's the best treatment for you. So it can tell me, if you come into my office and say, hey, I've got this coronary CT scan, I have a lot of calcium, I'm worried. I can say, hey, knowing you, I think this surgical strategy might be best and will prolong your life the most.
It's basically a way of finding the most effective treatment.
Correct. Absolutely.
And then when it comes to the approaches right now from healthcare providers, do you see that different approaches are taken when it comes to men and women?
Sure, the approach should generally be the same, but it's often not quite the same, which is why it's lovely at times to have other people as providers. So having more women providers, having more minority providers. So I see a lot of women, and I'm proud to see a lot of women. They can ask me about certain things that they're worrying about, cosmesis, anything after surgery, that I'm happy to address with them.
Sometimes I think that we may feel like we're not heard. How do you follow your gut when you know that something is wrong with your body, and how do you advocate for yourself? Because sometimes we may say, like, the doctor knows, so if they're saying it's okay, it must be okay.
Again, knowing your family history is incredibly important because we do take that into consideration. The hope would be that you have a good relationship with some provider, someone who's known you or knows your history and can say, you know what, I know you know yourself, let's get this test to verify or not whether or not this could be a problem. And then once we have all that data, then we can move further if we think you're having symptoms that seem like they may be part of coronary artery disease.
Is it nice when you have a patient that comes in informed and is asking questions and is engaged with you, even if they don't agree with what you're saying?
Yeah, sure, of course. We should be your partner in health. So if you have questions, we should be able to address those questions and address your concerns. That's how you build a relationship, and you can solve a problem when it develops.
So when I'm heading into my appointment as a patient, and I want to make sure that I'm informed so I can ask good questions, good follow-ups, are there any resources for me, any places that I can go to get information so I can be well informed when I go talk to my doctor?
Sure. I think the American Heart Association website is a great place to start.
Dr. Spragan, thank you so much for being here with us. You help us get a more comprehensive understanding of women's heart health, and it was a pleasure to spend time with you.
Thank you so much. It's a pleasure to be here. Thank you for having me.
And thank you for being with us, and stay tuned for more Red Chair discussions from the American Heart Association.